What's up, guys? Hey, Les. All right, Les, we're going to wait for a couple people to come on, but I'll bring you on. Hey, Billy. Happy Saturday, guys. Happy Saturday. At least we can chill. How's everybody doing? Hold on, Les. Let me see if I can bring you on here. Hey, Shannon. No, that's Billy. All right, bring them on. Add. Hey, Melody. Connecting. Hey, Les.
Hey, how are you?
How are you, sweetie?
I'm good. Can you hear me?
Good. What?
Can you hear me? Apparently
I can
not.
hear you. Well,
Huh?
no, I can. I need to put my earbuds in, but my phone is not like charged all the way, so
Oh
I'm
yeah.
afraid it would die if I tried to do the earbuds thing. So I'm just gonna keep it plugged in for a little while, and then I'll probably switch it over to my earbuds.
Okay.
How's your Saturday?
So far so good. Everything's fine.
What?
So far so good. Everything's fine.
So far, so good.
Yeah.
Good.
I'll try to.
Good. Good. How is it there? Where do you live again?
I am in Texas, in
Yeah. What part?
Fort Worth. So,
Okay.
the Metroplex, Dallas Fort Worth, on the Fort Worth side.
Okay. Nice.
So, yeah, weather today is in the 60s.
Oh,
So it's
nice.
nice. It's nice and breezy, but warm. So
But warm.
it's
Yeah.
been cold all the
That's.
way
You
up
know
to
what? I would
today.
take that though.
Oh yeah,
I would take that. It's chilly here.
yeah. The whole last week was pretty miserable, cold and rainy.
Was it?
Yeah,
Ugh.
yeah. But
Yuck, yuck, yuck.
it's better than snow and ice, so we'll take it.
Yeah. Yeah. We got a tiny bit of snow here in late November, I think it was, but we really haven't gotten snow yet. I should knock on wood because
You're
I
tempting
don't like the
fate.
snow. No, I know I am. I don't like the snow. I mean, I deal with the snow okay because I grew up in New England, but I don't like it.
Well, you're in Maryland.
I'm in Maryland. Yep. I'm just outside of the DC area. I'm
Okay,
about 20 miles east of DC.
gotcha. All right. Yeah, it gets
Yeah.
cold up there.
Yeah. Yeah. The weather's so wacky. Like it can be like this time of year, like last week we had 2 days that were like 62 degrees,
Right,
but it was rainy. And then like the day after it was like 30
right.
and cold, you know?
I used to think that only Texas was that way, but now I'm kind of finding out that it's pretty much that way everywhere.
Yeah,
Yeah.
it is. It is. Do you guys get a dry heat down there or like a
No,
humid?
it's humid. It's humid
Yeah.
where I'm at. Yeah. I live.
It gets really humid here too.
Yeah, I lived in Colorado for a few years, and that's a dry heat. It's completely different.
Yeah.
But
Yeah.
here it's humid as hell in the summer, so it's pretty miserable.
Yeah.
Yeah.
Yeah. All right. Who else here? We got Chris and Wade. Hey guys. Everybody say hi to Les
What's up?
and Victoria and Sharon and
Make sure this is
Melanie and Galen. I like to touch base and let people know we see them. Hi Kate.
sure.
So Les, where are you from?
I'm originally from East Texas. So
Okay.
I told you I was in Fort Worth. So about an hour and a half east of here is a little town called Tyler. Not so little
Okay.
anymore. It's kind of grown up. But I grew up in South Tyler, and I graduated from a little high school called White House High School in East
Okay.
Texas. So that's where I grew up. When I was 19, I got the hell out of there. And
Mm-hmm.
that was about the time I moved to Colorado for the first time.
Okay. And
Yeah.
how long did you live in Colorado?
The first time I lived in Colorado Springs, and I lived there for 2 years. And then moved back to Texas. So I moved to Colorado, met my first wife, Bethany, and knocked her up. So we got married because I was,
Yeah, score.
I was raised, I was raised in East Texas, in a church-going community. So it was do the right thing, marry the person, even though I'd only known her for a couple months.
Yeah.
So we got married and moved back to Texas because it was more cost effective, and I had family here. Her family
Okay.
was moving away, so
Okay.
she didn't have anybody there. So we moved back to Texas at that point. And then when my son was right around 2 years old, we split up. And she moved to Kansas because she had family there, and took my son
Oh, okay.
to Kansas with her.
Oh.
Young and dumb, didn't understand law and the fact that, when we split up, I could have, gone to court and had her within a certain distance, but I wanted her to, have the option of being near family. So, in
Yeah.
hindsight, not the smartest thing. And, we all have regrets, especially from stuff we do when we're young. But
Yeah.
so that was that. And
Yeah.
about the same time, it was in '99, I met um, Cassie, who was my second wife. And Cassie was a nurse. And we ended up getting married in 2000.
Okay.
And then in 2002, February of 2002, she was diagnosed with colorectal cancer.
Oh,
Yeah, it
wow.
was pretty out of the blue.
Yeah.
Um, so I had worked for Home Depot. I did retail work. My parents, when I was growing up in East Texas, had their own flooring store, carpet
Mhm.
tile. They sold and installed flooring. So I kind of grew up around that. Had quite a bit of knowledge in that stuff. So that's what I did at Home Depot for a long time. And so Cassie had encouraged me to go to school. She was like, "You're too smart to, be stuck in a retail position the rest of your life. You need to go to school." And
Yeah.
so just before, and wanted me to go into nursing. I didn't think I could deal with the blood, the guts, the shit, the pit. I didn't want to deal with all that stuff. But she had been a long-term care administrator or director of nurses. So she said, "Look, you can do like long-term care administration, where you're not involved in the nursing, but you're just involved in the administration side, and they make good money. And
Mhm.
there's always going to be long-term care facilities around. There's always going to be a need." So I had actually started to school and was in into my first semester of school, going into my second semester when we found out that she had cancer. And what I
Mhm.
found out when I went to school was I loved it. Um, I was not 18 years old going directly into college. I was a little bit older. I was paying for it
Yep.
myself. I was a little
Yep. Makes you
more,
appreciate
yeah,
it
I
more.
was a little more appreciative of the fact that my money was being spent for this.
Mhm.
And I've always kind of been the type of person that likes to learn things. So I kind of had this real kind of love developing for education and for learning.
Mhm.
So I was had just signed up for classes and bought my books for my second semester, and getting ready to actually I just started my second semester, and she was diagnosed. It was February of 2004. So it was around Valentine's Day, and her birthday was February 22nd. And I was at
Mhm.
work and got paged over the intercom. I'm sure if you've been in any retail business, they don't do
Mhm.
it as much anymore. They use walkie talkies now, but they used to page people on like, "Les, call 853," and you'd pick up the phone. So I picked up the phone, thinking it was a customer. And it was her, and she was in tears and had been to the doctor that day. Um, Come to find out, now that I've lived more life and now that I do what I do, she was a nurse. So nurses are pretty notorious for taking care of themselves last, and kind
Yes.
of ignoring things that
Yep.
happen to them. So she thought she had just a hemorrhoid that was kind of getting out of control, and she went to the doctor, and they said, "This isn't a hemorrhoid. This is something much worse." So that began, and that was around, like I said, around Valentine's Day of 2004, and that just kind
Mhm.
of began this whole just mad roller coaster of tests and treatments, one thing after another. Um, So once she was diagnosed and we knew it was cancer, I went ahead and dropped my classes for that semester so that I could, have the time to be with her and go to her appointments with her.
Yeah.
So immediately they did surgery and then radiation and chemo pretty much simultaneously. What I didn't know then, because I didn't have any kind of training or understanding, is that the reason they did that was because they knew it was bad. They knew it was very bad. So, um, radiation, chemo, they went 6 weeks. After you get chemo, you have to let your body heal, and then they'll do more scans. So they did that and found that it had moved to her lungs. So another round of chemo, another 6 weeks. Anybody that's been through this can tell you kind of what the torture of, especially after you're done with the treatment and then waiting for your next scans, does to you. So um, after the second round of chemo, after they found it in her lungs, they found it in another lobe of her lungs, as well as the one that it had been in her adrenal glands and lymph nodes. Again, not knowing, just being a layperson, not knowing exactly how serious it was, still holding on to hope, So another round of chemo, another round of waiting, and then the next scans, um, she had started having some headaches and some problems with speech. And so they did a brain scan and found out that she had a brain tumor. So they started her on another round of chemo. And the second appointment, we were sitting in the infusion lab at Texas Oncology here in Fort Worth, and her blood pressure shot through the roof, stroke level. and
Wow.
and so did her heart rate. Her heart rate shot up. So she was, looked like she was having a stroke. So they shot us over to the hospital right across the street, to ER, did another brain scan, and found out that the tumor was still growing despite the chemo. And at that point, they discharged us and sent us for palliative radiation. And so, again, not knowing what palliative meant, and for those people that don't know, palliative just means comfort. It means we're doing something to try to give you some quality of life, not a real treatment for the root cause or trying to cure. It's not curative at all. But I didn't know that. We sat down, went to the radiology appointment, and she had two of those treatments. And luckily, we had a really good radiologist at that point, who was also I found out in hindsight, was a hospice medical director. So a lot of doctors, especially a lot of oncology doctors, some radiologists, um, will, in addition to their practice, will be hospice medical directors as well. So they'll serve as a hospice doctor as well. Just because there's not that many doctors that specialize in hospice
Yeah.
and end of life care. So luckily we had him, and after her second appointment, they did another scan, and the tumors were not responding at all to the radiation. So um, he sat down with us and he held both of our hands and he cried. First doctor I'd ever sat with
Wow.
that shed tears. And at
Wow.
that point, it hit me, that this was it. And so he
Yeah.
said, "Look, this isn't doing any good. And I'm going to send you home with a referral for hospice, for home hospice." And so my first experience with hospice was, the next day they came in, they did an assessment. We signed all the legal paperwork. She was starting to be confused by then, so she wasn't able to sign her own paperwork. And they immediately started her on round the clock care, because of kind of her confusion, and she had started falling. Again, I didn't know, she was about 5'1", and by this time had lost a lot of weight, weighed maybe 100 pounds. So one night, a couple weeks before that, I woke in the middle of the night to a crash and turned the lights on, and she was on the ground. She had tried to get up out of the bed to go to the bathroom and fallen. She was just weak and confused, and so I didn't know what I was supposed to be doing. So literally, I would pick her up in my arms, cradle her and take her to the bathroom. And so I had been doing that, for a couple weeks before we even got to the point that we were. Oh, go ahead.
No, it's okay. I'm just gonna turn it off.
Okay.
Go ahead.
So I've been doing those type of things for a couple weeks before we even, were told it was time for hospice. But um, the hospice came in. She was also having a lot of pain and had started having some breathing difficulties. Things had been just kind of snowballing out of control. So they had started her on continuous care, which means a nurse is stationed at the bedside in the home round the clock to give to assess every hour and to give medications as needed. So and 2 days later, she took her last breath and flew away. And it all happened, and that was March 9th of 2005. So it all happened within a 13-month period. It just was
I
like,
see.
in hindsight, 13 months sounds like a lot of time. But when you're in the middle of all this stuff, it
Yeah.
just seems like it was yesterday that, this diagnosis happened, and all of a sudden she's laying in her deathbed. So it was a whirlwind, and so I, um, you know, I lost her, and um, at that point, I went into a pretty dark place. Um, a lot of drinking, not wanting to be at the house because that's where she died, um, and making a lot of really just poor decisions.
Mm-hmm.
Um, and so um, at that point, I had reconnected with, a few months later, I'd reconnected with my first love, which was a girl that I dated in high school who had broken my heart several times while we were in high school, but it was high school. What are you going to
Yeah. Yeah.
do? And by this time, she had been married and divorced and had two kids, remarried, and was telling me that she was leaving her husband.
Mm-hmm.
And so we started seeing each other. Um,
Okay.
Again, in hindsight, a poor decision. However, as I'm sure, and the reason why I will get this personal is because I know that other people have gone through
Get
this
it.
stuff,
Yep.
and that our particular community of our family of people here, some people are going through it right now or might
Mm-hmm.
be thinking about going through it. So but we reconnected. She was still married, um, and had told me she was leaving her husband. And so we started seeing each other periodically, 2 or 3 times a week. She still lived in East Texas. So we would drive and meet, or she would come up to the Metroplex, or I would go to Tyler and get a hotel room. And so, in essence, we were just carrying on an affair. And I'm not proud of that. Um, but it's what happened, and it's the mindset that I was in was that I needed to fill the void that was left, and
You
so
need to feel.
and yeah, and she was a familiar person and somebody that
Yeah.
I had always, your first love. She was my first
Mm-hmm.
everything. So, you always kind of have this nostalgia that you carry around for that person. And then to have that opportunity later in life and to still be, attracted to that person, still kind of be able to connect on multiple levels with that person. It just made it too easy, to fall into
Yeah.
that. And so this was towards the end of the summer, beginning of the fall, after Cassie had died. So just a few months after Cassie had died.
Hmm.
And the one thing I told her is, I'm like, look, I've been in a very dark, dark place. And the one thing you can't do is tell me that you're leaving your husband and we're going to be together and blah, 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 and not do that. And so the one thing she did was told me all those things. In fact, we went so far as was moving out of the house. I couldn't stay there.
You
I
what?
was moving out of the house that Cassie and I lived in. Couldn't stay there.
Okay.
Getting a new place. She had come up one weekend and we had gone and picked out furniture for the house. In fact, furniture for her girls' room and furniture for another room for Ryan when he came on the weekends that he came. So all this stuff was set to be delivered. And 2 days before it was going to be delivered, I tried to call her to ask her some questions about, they had some questions about something wasn't available. So could we take a different color of whatever, something stupid.
Yeah.
And she didn't answer the phone, didn't think much of it, left her a message, and didn't hear from her all day. So I texted her towards the end of the day, nothing. The next morning, text her again, nothing. So in essence, this was before ghosting was a thing, you know, but in essence, she just didn't communicate with me at all. And so
Oh my
finally, the
God.
next day, I texted her and I said, look, I need to know if something happened to you. Like, did your husband find out about what was going on? Did you tell him? She was supposed to be having the talk with him, obviously. But she finally called. Or no, she texted. I'm sorry, she never called. She texted and
She never
said, no, no, no. She texted and said,
called.
he knows, he found out. Um, and he's begging me to stay, and I'm going to give him another chance. And so I canceled the furniture that I'd ordered for her daughters, and just went back into that darkness, that dark, dark. In fact, it was much worse at that point, just because,
Yeah, no, I get it.
you know,
I get it.
um, and obviously, like I said, and I'll say this probably a lot during this, is in hindsight, in hindsight, because in hindsight we see much more clearly, and as time buffers these things, we kind of get to see um, the places where we took a left turn that we probably should have taken a right turn or stayed straight on the course. So, but in hindsight, yeah, it wasn't a good time for me to be in a relationship like that, and it wasn't for sure to be moving that fast, and then also obviously to be involved in a relationship with someone that was married, you know. Um,
Oh yeah, yeah.
so a lot of pitfalls, a lot of mistakes that I made at that point, and then continued to kind of just make mistakes with relationships, trying to fill that hole that was left, and the hole had gotten bigger, not smaller, because there's a thing that they call delayed grief or delayed grieving, where we put our grieving process kind of on pause for whatever reason. Um, but eventually it starts again. Eventually we pick up where we left off, or we've been set back, and we have to
Step
kind
back.
of restart. Yeah. So that's where I was, and then kind of continued to make poor relationship decisions, and um, that kind of brought me to the point where I met. I'd kind of set everything aside for a while, was just starting to be okay with being alone. Ryan's my son's Ryan. So Ryan's mother and their family had
Mm-hmm.
moved back to Texas, so they were local. So instead of seeing Ryan like once a month, a weekend, which was great. Um, so our relationship started to really get closer,
That's
and
good.
things were okay. And so I started dating again. I put a profile on one of the dating sites, and I met this girl, and we started talking on just chatting back and forth on the dating sites on the website we were on. We had matched or whatever. It was OK Cupid. So back in that day, this was
Mm-hmm.
so this would have been 2009. Yes. So I guess I should fill you in on what happened after Cassie died was, and after this failed attempt at a relationship, I kind of pulled things together on not on a relationship level, but on a personal level, in that I wanted to go back to school and continue my education. So, and at that point, I decided after I had re-enrolled in school that I was going to pursue nursing. Um, when Cassie was alive, pushing me that direction, I resisted because I didn't think I could take care of people and clean up after people and do all the nursey kind of things. But what I realized as I got
Mm-hmm.
kind of a little further away from her death and looked back is that I was doing all those things with her, from cleaning her up. I was doing her medications. I was all of the things that a nurse did, or that I thought I did. I was doing those things with her, and she was my wife. She was the closest
Yeah.
person I had in my life. So in my mind, I thought, well, hell, if I can do it with her, I can do it with anybody. And so I did start back to school. I got all my prereqs done for the nursing program, and I got into the nursing program. And in 2009, I graduated. A year into the nursing program, though, I had the thought that I wanted to do hospice. And the reason why is because as I looked back on all of our experiences together, her as a nurse and the things she did, and then also, um, the oncology nurses, the nurses at the hospitals, all of those people that we came into contact that cared for Cassie, the biggest impact to me and to her, I think, was at the very end of her life and the nurses that came in then. And to me, they were like angels. So about a year into nursing school, I
They have
knew
more
that.
compassion.
Well, yeah, to me they did, and so empathy is a big thing. And so everyone that I had contact with at the end of her life that was in hospice really, to me, made a huge difference. I knew that I wanted to try that. I didn't know how I would do, but I knew I wanted to try it. So I graduated nursing and started working at a local hospital because I had asked, you get about one lecture worth of end of life care. It's a very neglected kind of part
Yeah.
of nursing school. And I think it's because, there's so much to learn in nursing, and there's so many kind of paths of nursing. So you got to think, you start from OBGYN, where or OB, where you have pregnancy and you have a developing baby, and then you have birth, and then you have pediatrics, and then you have normal adult stuff, and then you have a little geriatrics, and then your complex nursing, which is your kind of like your ICU, ER kind of nurses.
Mm-hmm.
but not much thought is given to end of life care.
Yeah.
And so I had about one lecture worth of that. And that's just kind of the way I think our culture is too,
Yeah. Totally.
because
Totally.
it's taboo. You know, we don't like to
It is
talk
taboo.
about death. We don't like to talk
Yeah.
about our own mortality. We don't want to think about it.
Yeah.
So that part of nursing school was interesting to me because they talked about it during one lecture. They showed us a movie, on end of life, and it was like, okay, that's it.
That's it.
Um,
Yeah.
so I graduated, and I was working at the hospital. And so when I graduated, I knew I wanted to do hospice or try hospice. So I just picked up the phone and started calling hospices. And most of the hospices said, look, get a year's worth of nursing at a hospital under your belt. And that will give you some good clinical experience, and then start applying and trying to get a job in hospice. So um, I got a job at a local hospital in the med surg unit, which isn't the most prestigious unit, because it's basic. People come in with, if you come in with pneumonia, you're going to be in a med surg unit. If you have surgery and you come out of surgery and you don't have a lot of complications and you're just going to be at the hospital for a few days until you're discharged, you're going to be in the med surg unit. So those are the type of patients we
Mm-hmm.
saw. But we also saw a lot of patients that had chronic diseases and terminal diseases. I took care of several AIDS patients. I took care of a lot of Alzheimer's patients that had fallen, and had a hip replacement. And so I took care of a lot of patients that, in hindsight, again, I didn't know, but in hindsight, would have been appropriate to be on hospice, and really probably were hospice patients. They just landed in the hospital. So I did my year there, and towards the end of that year is when I met Sonia. We met online, and we talked online back and forth, via just. And then one night, she said, "Can I call you?" And I said, "Sure." And so she called me. It was probably 9 or 10 o'clock at night, and we talked until the sun came up the next morning. And I said, "Look, we've been up all night. Um, we obviously have some kind of rapport. We're having a good time talking. Why don't we meet for breakfast?" And she said, "Oh no, I cannot meet you for breakfast. I look like hell and it'll take me an hour or better to get ready." So, and which is funny because in hindsight, again, once I got to know her, she never went anywhere in public, without her makeup being perfect,
Oh wow.
without her hair being, done and perfect. That was just who she was. And so
Yeah.
a couple of nights later, we had planned to meet up at a local, pub. And so we did, and we talked for hours again, closed the place down, and we walked outside. And it wasn't love at first sight. A lot of people are like, "Oh, it was love at first sight. Oh, I knew what was gonna. It was we were gonna be together forever." I wasn't in that place. And I was a
Yeah.
little guarded. I was a little guarded because of all the shit that I had put
Oh
myself
yeah.
through after Cassie died. So,
Definitely.
but I knew that I liked her. I liked her a lot. And I knew that no matter what happened, um, whether we were going to be romantically involved or not, that she would be one of my best friends for a long time. Like I just knew
Mm-hmm.
she was that type of person that once you are her friend, um, you're her friend for life. And I'm that same kind of person. So I just knew, and I told her. I looked at her and I told her. I said, "I really like you. I really like you." And um, so things started to progress. We started to actually date, and we kind of went on some up and downs, just because, again, I was so guarded that I didn't want to give my heart away to someone and have them um, pull that rug out again, you know.
Yeah.
So we did for about a year. We went kind of up and down. We'd be together, and then we'd take breaks, and that was me pushing her away, you know. But she was so patient, and we never fought about things. We never, you know, she wouldn't be angry. Um, she just kind of stuck with me, and even when we weren't dating, we still talked almost every day, you know. And she had started um, dating again and had had a couple of dates, and I started finding myself being jealous, and and um, and so I knew, like, I don't let if I don't let her have my heart, and if I don't trust her, and if I don't trust somebody again, then I'm going to lose her, you know. And so I did, you know, and we sat down and I said, look, I'm ready for this to be just you and me, and I don't want to lose you. And so we got together, and by this time, I had started working in hospice. I picked up the phone one day, almost a year to the day of me working in a hospital, because they said, wait a year. So almost a year to the day, I picked up the phone and started calling hospices. And the first hospice I called said, why don't you come in for an interview? So I did. And they
Nice.
said, look, this is a local hospice. They weren't a national hospice. They just had their office. And then they also had a freestanding inpatient unit, which is a place that they had 18 beds. So it's a unit where people who are very acutely sick, actively dying, that have a lot of symptoms that are going to be very difficult or impossible to handle for the family at home can be moved into that unit. And it's not like a hospital. The rooms are very large, can accommodate a lot of family. It looks
Yeah.
more like a kind of a nice hotel almost. Um,
Yeah.
so it was a beautiful place. I was so impressed, and I was impressed with the people that were there, that were working there. So they said, "Why don't you come and just take a PRN job?" And PRN in the medical field means as needed. So in other words, I would be able to pick up shifts and kind of slowly dip my toe in the water to get a feel for if this is something I really wanted to do. So I
Mhm.
went through orientation, and I had picked up, I think, one shift in the unit, and the manager, or my manager, called me into her office and said, "Look, we just had another hospice in the area that went out of business, and we are picking up 22 of their patients, and we need another nurse full time. And are you interested?
Oh,
Because you're first in line for this job if you want it. We want you to work for us and on a full time basis." So I said, sometimes the universe just gives you these opportunities and then kind of nudges you. And so I felt like instead of dipping my toe in, it was time to just dive in. And so I
dive
did.
in. Yeah.
And so I did, and I took these 22 patients and became a hospice nurse. And so that was
Wow.
2010, and hospice is all I've done since then. So
Wow.
I'm a hospice nurse,
Wow.
you know.
That's awesome.
So about the same time, Sonia and I got together, and so about a year later, we kind of got together in a more official way, and we're you know exclusive and dating. And about a year after that, so it was 2012, we moved in together. And she had been married before and divorced and had her own home, and I was renting. So she said, "Look, you're moving in here. Obviously, this mortgage has been paid for 12 years. So and you're renting, so let's move into this house together. So I did, and about the same time, Ryan had turned 12, and he decided that he wanted to come live with me. So he did, and he had been living with me for maybe 6 months or so. And so we both moved in with Sonia and um, made our home there. And um, so we lived together for a couple of years. And then in 2014, neither of us thought a whole lot of um, getting married one way or the other, just because we had both been married, been there, done that.
Mhm.
And it was a piece of paper to us. But
Mhm.
um, our families, of course, how everybody wants, oh, are you going to get married, blah, blah, blah. And so we
Yeah.
decided, okay, let's do it. We're committed. We might as well make it legal. And so we had been to Colorado the year before because I wanted her to see Colorado and why I loved Colorado so much. And we had been on a family vacation the year before, and we had taken Ryan up to Denver and the mountains. We went up into Estes Park. And when we were in Estes Park, we found this little waterfall. It was kind of set off the road. And we had gotten out and kind of walked around it, hiked around it. And it was just a beautiful little area. And so we decided that the next year when we went back, um, it would be just me and her, and we would get married in Colorado, just me and her. We had done some research, and I found out that in that particular area, I don't know if it's the same statewide or if it's just in that county, or some of the counties, but you didn't have to have any witnesses. You didn't have to have anybody officiate your wedding. You could basically serve as those people yourselves. And so,
Oh,
yeah, so we went and got our marriage certificate and went up back to the waterfall that we had been at the year before. And we sat, I think I've posted it. I know I've posted it on my personal page. But I just set up a camera on a tripod and recorded it. And in hindsight, again, I'm so glad that I did, because
mhm.
even though it was a very private moment, um, I'm now able to go back and kind of relive that.
Yeah.
Um, and so that was September 25th of 2014. Another little backtrack about Sonia. Um, is that she was born with a rare congenital disorder called Klippel-Trenaunay-Weber syndrome, and they call it KTS for short. And what this, excuse me,
Okay.
so what this disorder is in the womb. It's a genetic disorder, and what happens is some of the arteries and veins, as the baby's developing, grow together. So, kind of brief anatomy thing. Your arteries carry blood to your body from your heart and your lungs that's oxygenated um, to all the tissues to provide oxygen, and then it returns through your veins, not oxygenated, to be reoxygenated. And that's kind of how the cycle works.
Mhm.
So they're two separate vessels for sure. So what
Mhm.
happens is, in this defect, is some of those grow together, and so in a lot of these folks, and it's very rare. In a lot of these folks, it happens typically in one extremity or the other, and it can be in one leg, either side, or one arm, either side, or one side of the body. It's a lot more rare when it's two extremities on one side. So hers was her left lower extremity, her left leg. So on her left butt cheek, basically, And it's very indicative of all these people as well. She had what they call a port wine stain, and you can Google it and look at it. And it just looks
What's it
like
called?
a port wine stain. So like port wine
Port wine stain.
stain.
Okay.
Yeah. So it looks like a wine stain on your flesh. And again, it's just because of the vascular
Yeah.
abnormality. But all these people that have this disorder have that. It's a hallmark. So hers was her left
Interesting.
leg. So the other thing that happens, because the arteries and veins, some of them grow together, is you get very poor oxygenation, poor blood flow in that area, because when the blood gets
Mhm.
there, it's not real clear on how it's supposed to get back up to your heart, to your body.
Yeah.
So, and then one of the other hallmarks is whatever that extremity is, usually has a little bit more excessive growth than the other extremity. So usually those extremities are a little bit larger. The bones grow a little larger, and it's compensation mechanism. Like it's trying to
Yeah.
get bigger, so it gets more blood. You can kind of put the rest together. So hers was her left.
Yeah. Yeah.
Hers was her left leg, and hers wasn't the most extreme case. A lot of people that have this disorder end up having to have amputations,
Oh,
and she
yeah.
didn't. She was able to manage it with. She was on blood thinners pretty much from the time she was a teenager. But chronic pain is another thing, because if you don't have circulation to an area, it hurts. It just causes
Oh,
pain.
yeah.
So she had kind of lived with this chronic pain her whole life. Also, when she was a teenager in her early 20s, she was in several bad car accidents. So her back was also a very, very bad. So she lived with kind of this chronic pain that was managed with, she took Norco, or, hydrocodone. She didn't
Hmm.
take a lot. She had a very, very high pain tolerance because of that.
Hmm.
Um, so, so she has this disorder. She has chronic pain, and she kind of thought, well, look, this is a rare disorder, and this is going to be kind of just the thing that it's my thing. Everybody kind of has a thing that they have to overcome in life or deal with,
Yeah.
obstacle
Yeah.
that kind of is just there that you always deal with, whether it's physical, emotional, psychological, whatever. Everybody's got something, right? And she thought,
Hmm.
this is my thing. This has got to be it. So we are up in Colorado, and we're staying right outside of Estes Park in a little cabin on the Fall River. And it was just one of the most beautiful. We went in the fall. The aspens were changing. The elk are out, um, mating season. And so it was just perfect. And except for she was having a lot of pain and lower back pain, which she had normally, but it was way worse than it normally was. So we go to get in the hot tub on the back deck of our cabin one night, and she got into the hot tub, and her pain skyrocketed, just went through the roof. Which, for somebody with back pain, usually getting in a hot tub or heat helps relax the muscles
Yeah.
and makes you feel better. So it was kind of the
Hmm.
opposite reaction. And so, because we were in Colorado, we also had, some edibles with us that I said, look, try this. It's helped with your pain before. And so she did, and that didn't help either. So finally, it calmed down. We were almost to the point of taking her to the hospital, just because, like I said, she has this super high pain threshold. So for her to be in pain and say she's in pain and be kind of writhing in agony, the red flags were going off. But things finally
Yeah, I'm
started
sure.
to calm down, and she started feeling better. So we get back home after we get married and our little honeymoon, whatever. And 2 weeks later, she has another similar kind of thing happen where her pain is just out of control. no matter what medicine she's taking, nothing's working. And I said, look, it's probably time to go to the hospital. And so we did.
Yeah.
And we ended up in the local ER, and they did a CT scan of her back and her abdomen. And the doctor walked in, the ER doctor walked in and sat down and says, well, it looks like you're dealing with cancer.
Oh,
Just
oh
like
my God.
that. Yeah, just like that. And this is the type of person that Sonia was. She had known what I went through with Cassie, obviously. She had heard every little detail, every emotion I had about it. She knew all of that stuff. And the doctor said that, and the first thing she did was turn to me and said, I am so sorry that I'm doing this to you. And I said, we just got told she had cancer, and she's apologizing to me that I'm going to have to go through something hard. That's the type of person she was. She just cared more for everyone else than she did even for herself. And so, um, so 2 weeks after we were married, the fight was on. We started this, what turned out to be almost 4 year battle with cancer. Um, so what they found was a mass in her abdomen that was about the size of a football. It was big.
Holy shit.
Yeah. So they couldn't tell, obviously, from the scan what it was, but they knew that it was right around where her uterus was. So they thought it might be uterine cancer. So they sent us to um, a gynecological oncologist. And I now, of course, I'd been working as a nurse for 5 years in the area, and so had obviously made lots of friends in the nursing community, had lots of connections. So I was able to make some calls and find out, like, okay, who in this area is the best gynecological oncologist. And so I found out from several people, heard the same name. So we went to that doctor, and he was wonderful. He was a wonderful doctor. Um, and said, look, you've got this massive tumor in your abdomen. We don't know what it is. Could it be benign? Yeah, it could be. Do I think it is? Probably not, but we need to go in there and take it out. So we scheduled surgery. She went in for surgery, and right after they were done taking it out, the doctor comes out, obviously, to the waiting area to give us an update and says it wasn't uterine cancer. It was just so large, and where it was placed, it was obscuring her uterus. So they didn't have to take out her uterus. They did have to take out one ovary because it had attached, and they had to take out her appendix because it had attached there as well. But he thought that he had gotten pretty clean margins, which means um, so when cancer grows in your body, depending on where it is, and when they go in to take it out surgically, um, they want to get what they call clean margins, which means if they can get every bit of tumor that they can see, then that's clean margins. So, but if it's attached to different things, depending on where it's attached, they may not be able to take out every single thing, because if they do, then they might be cutting into or taking a part of your
Yeah.
body that you need and you can't do
Yeah.
without.
Yeah.
But he was able to get clean margins from what he saw. Um, but he looked at me and he said, "But it's not uterine cancer, but it's a cancer I'm pretty sure is leiomyosarcoma." And even as a nurse and as a hospice nurse, I had never run across that kind of cancer. And so I knew right off the bat it wasn't something that was kind of a routine carcinoma or something. It was a sarcoma, which I knew was bad, but also a very rare disease, type of sarcoma. So sarcomas are rare to begin with, and then this particular sarcoma was rare, doubly rare. So I started doing my research on it, and obviously um, went into things this second time with my eyes more open. And I have
Yeah.
people ask me, was it better to know? Like the first time, didn't know a thing. Was it better to know or not to know? And that's a hard question to answer. Um,
Yeah.
I think
It's a very complicated answer.
it's a very complicated answer. I think I fall
Yeah.
more on the side of I would rather have known, just because it made it easier for me to be able to help her, you know, and to explain things as we kind of went down this road, and have the confidence to know that the things that were being done for her were the right things. With Cassie, I didn't know. I didn't know if we should have ever asked a question about which particular chemotherapy she was trying, or whether there were clinical trials or any of that stuff. But with Sonia, I did, because um, I knew way more, obviously, about the medical field. I had way more connections, and my eyes were just open.
Yeah.
But the bad part about that is that I also knew um, what the expected outcome was, and that people with this particular cancer don't live very long. It's an anomaly when people live more than 5 or 6 years with this cancer, and most people 2 to 3 years. So um, she started on chemo. They did a round of two different chemos at the same time that were um, they're very old medicines, but they're kind of the tried and true chemotherapies that if you if you live through the treatment, um, it's usually effective for a while at least. And so she was a soldier. She was going to do whatever she could to not leave. And so obviously, after Cassie died, after the things I had been through after that with relationships, her one promise to me was, I'm never going to leave you. And so she would apologize, like, I never wanted to leave you. I'm so sorry that. And she didn't leave me. She was taken from me. There's a difference.
Yeah. Yeah.
And
There's a big difference.
so, but she always felt, even the last month of her life, she felt like guilt that she was leaving. And I tried my best to explain to her that she had nothing to be guilty for. She had nothing to feel that way for. But that was just the person she was. And sorry.
No, it's fine. It's totally fine. If you can't do this here, you can't do it anywhere. Come on.
Yeah, you're right. So, um, so they did this chemotherapy, and anybody that's seen, I've posted pictures of Sonia before. She had this long, beautiful blonde hair, and if she she wasn't a very vain person. She's a very humble person. But if there's one thing that she had a lot of pride, she always took very good care of her hair, made sure it was. So when it started falling out, it was it was pretty hard on her. And when we had to shave her head, because she held on to it for as long as she could, but it started coming out in clumps, and then um, she was brushing it and it would get, she couldn't brush through it. And so we had to cut it. And um, that's when when I was younger in a past life, I always shaved my head and had a goatee. It was just kind of my look for a long time when I was younger. But I had grown my hair out a little bit and had just kind of a normal haircut, whatever. And but when we had to shave her head, I started shaving my head again too. And a lot of people do that. Um, but again, she didn't let that um, bring her down too far. She had her moment of kind of her pity party, and then she picked herself up, and it was back to the fight. So, after this round of chemo and the 6 weeks of waiting for the scans again, just like with Cassie, um, they found a very small nodule in her lung. And the doctor looked at us and said, "Look, I'm a gynecological oncologist, but I'm not a sarcoma specialist. And you need to see a sarcoma specialist." So that was great because it wasn't somebody that was going to blow smoke up our ass and say, "Look, I can do whatever. Let's try this. Let's just,
Yeah.
So we went to, we live in Dallas, Fort Worth area. So we went to UT Southwestern, which is a school and a hospital, a learning hospital here. They do a lot of research in oncology, and it's in Dallas. So we went there and we sat down with the head of the sarcoma department there. And this particular I still get mad when I think about it. This particular doctor had just finished being one of the sponsors of a clinical trial for a drug that had just been FDA approved.
Mm-hmm.
And he told us, after looking at her chart and looking at her scans, that the only option he would really advise us to take, because we were asking, okay, so she's just got one spot that they see in her lung. Can we go in surgically and remove that spot? Could they remove the lobe of the lung? Like, they can do a lot of stuff surgically.
Yeah.
And he said, no, I wouldn't do that. I would do this drug. And it happened to be the drug that he had just finished sponsoring on this clinical trial. And so, already being involved in the medical industry, I know how this shit works, and doctors, it's not as loose and free as it used to be with kickbacks and stuff like that. The government watches that much more closely.
Yeah.
But if you think that a doctor that sponsors a clinical trial doesn't in some way benefit from that drug eventually making its way to market, you're fooling yourself. So we left very disappointed. And on our way back home from Dallas, I looked at her and I said, she was in tears and I was angry. And I looked at her and I just said, was that an acceptable, the option that he gave us, the one option, is that acceptable to you? Do you find that acceptable? And she said, no. And I said, well, then we're going somewhere else. And so we decided to make an appointment and travel to Houston. And Houston's about almost 4 hours south of us. But I'm sure everyone's heard of MD Anderson Hospital. It's one of the most renowned cancer treatment hospitals. It's all they do is cancer in the world, and we were fortunate enough to be within driving distance of that hospital. So we made an appointment and we drove down and had a consult with one of the sarcoma specialists there. And he said, well, first of all, our protocols are a little different. Obviously, he was being very, doctors are usually very politically correct when talking about other doctors, and their treatment plans and their preferences. But he knew that what we had been told at UT Southwestern was a bunch of shit, basically. He said, look, you haven't even had our first line chemotherapy treatment that we would try. So, and surgical intervention is absolutely an option. You've just got one spot. They can go in and do surgery potentially and just kind of pluck out that one spot. And so we obviously started with her treatment there. And she went through a lung surgery and went through something called a lobectomy and a wedge resection. They redid all the scans because they have all the highest end, newest stuff there. Things that may not be typically seen on a regular MRI or CT scan, they can sometimes see. And they did. They found a couple of more spots on the other side or on one of the other lobes, same side. So they scheduled her for surgery, and the surgeon that they scheduled her with was the head of the surgery department at MD Anderson. So couldn't get a better, surgeon, obviously. And he did a wedge resection and a lobectomy. So they took one of the lobes out of her lungs. And that's a hard surgery. Anytime you have surgery on your lungs. And she came out with chest tubes. And chest tubes are, after surgery, you obviously still have, anywhere you have surgery in your body, but particularly in the lungs, you're concerned with it because you have excess fluid, you still have some bleeding. And so what they do with lung surgeries in particular is they put these chest tubes in, which are drains, and it drains out the excess fluid so that your lungs don't back up with fluid, because if you do, you drown, or you get pneumonia and really bad things happen. So she had that surgery. She healed up from that, and they went ahead and started her on another chemotherapy. Again, scans revealed the next scan that she had some spots on the other side in her lungs. So more surgery. After that, more chemotherapy. After that, so we'll kind of fast forward because she went through several treatments. And during this time, and I think I posted about this not long ago, but because of this rare vascular malformation she had, she was in a lot of Facebook groups, kind of like we're in now, support groups for other people that just had this disease in their families. So she and I both were in these groups for KTS. And then also we were in groups for people that had leiomyosarcoma because that was rare. And so, you get to where there's people, especially other people that are fighting the same cancers and have the same diseases. You kind of get these bonds formed, and people are interested in what's going on with you and want to know, they want to pray for you. They want, all that good stuff. So we're in these groups. So we started actually doing, I started doing Facebook Live updates, and then posting them to these groups. And I was pretty faithful about doing that for her surgeries or for our trips down to Houston. And so we kind of became pretty ingrained and enmeshed in these groups. So we go through all these treatments, and in April of 2017, we get up one day and she starts having problems forming her words and stuttering. One of her eyes started kind of wandering off, and I knew right away. The suspicion is usually in a normal healthy person, it's a stroke, obviously. But with her, it was a little more obvious that it was probably a brain tumor. So we went to the ER. We had talked about driving down to Houston, but thought better of it just because things had happened so quickly. And again, because I'm a little medically trained, when you start talking about anything cardiovascular, um, your heart, your lungs, your brain, those are things that if they start having sudden changes, then you have to address them immediately. So we went to our local hospital. They did a brain scan, found out there was a tumor that was actually growing and putting pressure very close to her brain stem. And so our brain stems are responsible for basically our automatic functions or autonomic functions, which means your heart rate, your temperature, your breathing, the things that we do without thinking that just keep us alive. And so we were actually kind of fortunate that she also had some neurological changes that manifested as well, because otherwise she may have never known it and just dropped dead. So we again talked about and talked to the doctors there about should we go down to MD Anderson and have the surgery done. And again, it became emergent. So um, she was scheduled for surgery. We didn't know at that point. It was a very risky surgery. Um, but she made it through. They got the tumor out. And immediately after she woke up, she was talking normally. She was basically back to normal, except for having had this surgery. And so that was April of 17. So obviously she had to heal up from that and then back to MD Anderson. And that is when we started doing clinical trials. She had run out of kind of the standard treatment options. And so we moved into doing an immunotherapy clinical trial. And did that for a while with no success. And then she got into another clinical trial, again, with no success. The second clinical trial slowed the growth, but didn't stop it. And then she continued to have spots pop up. She had metastasis to her liver, to her pancreas. She had another abdominal area. And at, at, at that point, surgery started becoming one of the things that was taken off the table just because you can only chase things so much with surgery. As you do surgeries, what you also do is you, in a microscopic way, in a cellular way, you release more cancer into your system, and unless they can completely encapsulate it and get it out of there, which is with her cancer, just in the places it wasn't feasible. So she had started on a third clinical trial and started having some really negative effects from that, just uncontrollable nausea and vomiting. And so they stopped that clinical trial and decided we would just wait and see if things would stabilize. Because she has, once you start putting all these drugs into your body, especially a lot of the immunotherapies and some of the chemotherapies, you have these effects that where your body chemistry actually changes. And specifically with some of the immunotherapies they're starting to use, sometimes they'll use it, and while you're on the immunotherapy, it will seemingly have almost no effect. But sometimes months later, they're finding now that these immunotherapies have caused changes in your immune system itself, and your immune system actually starts to respond in a way that provides results even though you're no longer on the therapy, if that makes sense. So we were keeping our fingers crossed for something like that. So fast forward to um, March of 2018. We went back for follow-up scans, and they had found that it was again growing in her brain. There were some spots, and they did some targeted radiation there, which You know, is where you go in, they put you in they map everything out on a scan, and they put you in a halo. So, you know, you've got this big metal thing attached to your head so that
Mm.
they lock your head in when you go into and the radiology and the radiation, so that it's very precise. It's like laser pinpointed radiation, which helps some. But after it shrunk a little bit, we went for another scan in April and of 2018, and it was starting to grow again uncontrollably. So they basically sent us home at that point and said we could try more chemo, um, but that there really wasn't another clinical trial at this point that she would be eligible for, and they didn't believe the chemo would do anything curative for her. But if we wanted to, she wanted to try it, she could. So we went home and we talked, and she did not want to put herself through more chemo if it wasn't going to have any real chance of curing her. And so um, we kind of lived our lives, you know, and tried to just enjoy life as much as we could. She was having a lot more symptoms just because the cancer was growing in her pancreas and her liver, throughout her body. She was sleeping more, she was eating less. All the things that I know as a hospice nurse I look for in patients that are, you know, dying. And so um, the beginning of August, August 2nd, if I remember correctly, she again started having um, neurological problems, confusion, stuttering. So we knew that it had gone to her brain again, and we knew that surgery wasn't going to be an option. And so we called in hospice, the company that I worked for. Now, mind you, when we started going to MD Anderson, I took a job in hospice as a weekend on call nurse. Um, Very fortunate um, to have the career that I have, because in hospice, you know, most of the nurses work 8 to 5 Monday through Friday, and then there's on-call staff because we answer the phones, we treat patients 24 hours a day, 7 days a week. We don't take time off. So
Yep.
we have staff that covers the nights, and then we have staff that covers the weekends. So I had taken a weekend job a couple of years ago, um, so that I would be free during the week to take care of her and to make sure that I had during the week we could go to Houston, we could get her treatments, we could do everything we needed to do. And so I was just working weekends, which was great. So I called the doctor that I worked for, and I said, look, it's time to bring her onto hospice. And so we did, and they came and admitted her, and I don't know. Even in hindsight, right now, I haven't figured out kind of what triggered it, and I don't know that there is anything besides just the brain tumor that did it. But she went into a condition we call terminal restlessness, or terminal agitation, which means she was basically bouncing off the walls. She was confused. She was up and down, trying to get in and out of bed, but she was so weak that she didn't realize she really couldn't get out of bed by herself. So she would try to get out of bed and end up falling, you know. So, and then the terminal restlessness part of it is that she didn't sleep for 3 days. So that meant that I didn't sleep for 3 days. And so, again, the reason I told you about her um, pain threshold was because um, she had such a high pain tolerance that by the time we got to the point of hospice, she had had to start taking increasing doses of opioids. So she was on pretty much the maximum dose of fentanyl. And fentanyl is a very, very potent opioid. Um, she was on three 100 micrograms an hour is the max strength of a fentanyl patch. She was on three at a time, which even as a hospice nurse, I'd never seen anybody on that much. She was taking immediate release morphine tablets, 120 milligrams at a time, which is so. If I put three fentanyl patches on myself right now, probably 8 hours from now, you would find me dead. I wouldn't be breathing. I would be dead, and there would be nothing you could do about it. So this is the type of tolerance she had. So by the time we get her on hospice and she starts going through this terminal agitation and restlessness, um, none of this stuff was working. And so um, my company basically, my boss and the doctor, the other nurses were begging me to let them start continuous care and have a nurse at the bedside. Um, but I wouldn't do it. I felt it was my responsibility um, as her husband and as a hospice nurse to be the one that took care of her. And so I did, and I was very resistant to that. In hindsight, should I have for my own sanity? Probably. But I had too much pride, and I didn't want anyone else. Um, I don't know, it's a very personal thing, and it's different for me because now I'm a nurse, and so um, I took it very personally that I took care of her. I felt like that was my place in the universe right then. But we had to start actually using IV medications on her. And so she had a port that she had implanted for all her chemotherapy. So I accessed her port, and we were giving her, I was pushing 16 milligrams at a time of Dilaudid. And Dilaudid, again, is about 7 times the strength of morphine. And to give you a reference, so we would take care of, when I was in the hospital, we would take care of patients that came out of back surgery and having their back split open and discs replaced and things like that. Very painful surgery and very painful after the surgery. And the doctor that worked at our hospital was one of the doctors on staff at TCU, Texas Christian University, which is here in Fort Worth, for the football team. So we would have these big, football players, ex-college football players, ex-NFL football players come in specifically to have surgery done by him. So these big, 6'5", 300-pound guys, I could give them 2 milligrams of morphine, which is one little vial, and their pain would be gone, and they would sleep for several hours. It's that potent. I was giving her 8 vials of that at a time and giving it every couple of hours, and she was still bouncing off the walls. So that was 3 days, and my final outcome of as far as thought process goes on that was that she was not settled in her spirit. Her soul was not settled. It wasn't at peace. Um, and I think at some point, I went in, her brother, went in, her mother, my family. We all sat down and talked to her, and even though she would be confused, she had these beautiful kind of moments of clarity. And Sonia was the sweetest fucking person. But when she got cancer, she went into fight mode. And so I don't remember ever arguing um, when we were together before, but after she got cancer and started treatments, she changed a little bit. And things would rub her the wrong way and we would get in arguments. Nothing crazy. We didn't get mean, but, just it wasn't what I was used to. And so, again, in hindsight, I know what it was. It was she was fighting for her life, um, and we were going through this thing together, and I was the person that she felt like she could fight with, and because she knew I wasn't going anywhere, you know. Um, and so what happened though at the very end, so pretty much from the time she was on hospice, she was confused, but she would have these moments of clarity, and sometimes it would be a minute, sometimes it'd be an hour, sometimes it'd be a few hours. Um, but she was back to being just that sweet, loving, caring for nobody but herself person, She had fought and she had set that to the side and she found peace. And so after that 3 days, she was at peace and she was able to sleep a fairly normal schedule. Fairly normal meaning she slept about 16 to 18 hours a day. That's just what your body does when it's shutting down and cancer is taking over. But the times that she was awake, um, she would be confused and then lucid and then confused again, and which is hard, but it makes those moments that she was there even more special, because they were really sweet moments, So she was on hospice almost a month, and that morning she woke up, and her dad had died about 3 years before that of pulmonary fibrosis. He was a Vietnam vet. They weren't sure if, the reason why he had this pulmonary fibrosis was genetic or, Agent Orange type thing from Vietnam. I think it was genetic because all of his siblings ended up having it too. So she watched several of her aunts and uncles and her dad die with severe respiratory problems and having to struggle breathing. So that was her biggest fear. And that morning she woke up and woke me up and she was struggling to breathe. And so I did all the things that you do. I set her straight up, cranked the oxygen up, had a fan blowing in her face, and started giving her extra doses of anxiety medication. But I knew what was happening, and I knew it was going to be very quick. And thank God it was. It was a few hours later. She said goodbye to me and her mother, and that she loved us. And she got comfortable and she went to sleep. And a few hours later, she took her last breath. And I'm sorry, I didn't know it
It's okay.
hit me this
It's
hard
okay.
today.
It's okay.
But man, I miss her.
I know.
And she was just a beautiful person, just a beautiful person. Her soul was beautiful. And so sorry. That's my story.
No,
Um,
don't be sorry. Don't be sorry.
I'm not. I'm
Don't
not
ever
sorry.
apologize. Like
I'm not
Scott Maxie
sorry.
says, don't you dare apologize.
Yeah, I'm not sorry because um, I need people to know that we're not alone. I'm not alone. You're not
Yeah.
alone. None of us are alone. We
Yeah.
all,
Yeah.
even though nobody's story looks the same, exactly the same.
Mhm.
But I remember watching Chris Meeker and watching him tell his story and um, having to stop and step away, and come back
Mhm.
later, just because
Yep.
some of the things he went through, um, were almost identical, um,
Yeah.
different situations, but you know, hearing some of the similar things that he went through with his wife and with the agitation, the restlessness, those type of things. But it
Mhm.
made me feel not alone,
Yeah.
and I know I'm not. I'm a hospice nurse. I've been with a lot of
I
people
know.
that have died,
I
and
know.
I've walked through this with a lot of families, and I've been able to tell people, um, my whole hospice career, I could tell people, especially people who are losing their spouses, that I know how this feels. Um,
Mhm.
but with Cassie, it was a different journey. It's almost like it feels like I've led a couple of different lives,
Yeah.
you
For
know,
sure.
and
Or
I know it will feel that way again at some point, that I will feel like these things are kind of just, and I guess it's that way through life, but I think it's really more, more highlighted for us that lose the people we love the most, is that you kind of see these, lines of demarcation where your life changes drastically, and that you kind of begin a new life, you know. Not that those people are left behind, never. Those memories are always going to be there. Those feelings are always going to be there. It was strange because Sonia, was one of the only people that in fact, I'm going to say she was probably the only person that I dated or was with after Cassie died that wasn't jealous of my relationship with Cassie. And I always found it really strange that people were. Um, but I haven't been in their shoes either. I haven't been on that side of it, so it's hard to judge. But at the same time, you think, how could you be jealous of someone who was taken out of this world? They had no choice in that. It's not like they're a threat to you. They're not coming back from the grave. And so I always found that it was very odd. I had one girl that, I was with, and she wanted me to take down my pictures of my wife, of Cassie. And I was very, of course, that was it for that. I mean, that was the end of that.
oh
But
yeah. Definitely.
but I
Definitely.
don't know. And I say this because, um, these people, this is how some people think, and so
Yeah.
some of us will deal with people who are jealous of the relationships we had, with our late spouses, our late significant others,
Yeah.
even though it doesn't make any sense to us. Um, so again, if you go through that, you're not alone. A lot of us, I'm sure, have been through things like that. But Sonia was the first person that really wasn't jealous, and was very secure in our relationship, and that, in fact, because she knew so much about, my relationship with Cassie and the ways that Cassie had changed, um, my life for the better. She, would go to Cassie's grave with me, and, um, would talk to her and thank her for helping me become the person I was. If it wasn't for Cassie, I would have, a I don't know how long it would have taken me to deal with the fact that I was a child of an alcoholic, and that affected me into my adulthood. She was instrumental in that, and helped me deal with that. And then also that I became a nurse. That I had this career that isn't just a career to me. Um, it's way more than that. It means more to me uh, than ever selling a roll of carpet to somebody would have meant. I get to be in people's lives in their most vulnerable states, and and I tell people it's an honor. And now I get it. now I understand, when people say you're an angel, and I get that all the time. And I'm not an angel, trust me. You guys all know I'm not an angel.
I know,
But
but
the
it
feeling,
takes a really it takes a really special person to do what you do, though. So you have to know that.
I, I hear that a lot. It's hard for me just because of the person that I am to take
I know.
compliments like that. I don't like
I know.
it. But
I
I
know.
do understand the feeling of someone that's there that has knowledge of the situation that you're in
Mhm.
and that knows what to do when something's going extremely sideways and is calm and is can hold it together when everybody else is. So I know the appreciation that people have for that. Um, and people ask me, how do you how do you do this after you've lost a wife? And now people ask me, are you sure you want to do this? Like, you've lost two wives. And I lost Sonia in August. And people questioned how soon I went back to work. But for me, I find a lot of meaning in my work. And even
Yeah.
though, and what was funny is the second weekend that I was back at work, I admitted a patient. I actually helped this patient transfer from one hospice to our hospice because they weren't pleased with where he was, and that hospice had him in an inpatient unit and didn't really was hesitant to let him go home. Um, and he wanted to go home, and his family wanted him to go home. So I went in and helped them coordinate moving him home. And in fact, I am in contact with his widow because he again had cancer, and they're very young, they're in their 30s, and so she's actually been invited to join this group. Um, but
Mhm.
that was the second weekend I was back, and I was able to make an impact in their lives by getting him home, and he died a few days later, and by being able to tell her, like, look, you're not alone, and this is a new thing you're about to go through, you know nothing about, but know that you're not alone, and all you have to do is raise a flag, and you're going to have people there for you that do understand. So yeah, I think there's just purpose in life, and purpose
Yeah.
in particularly in what I do, and so that's
Yeah.
why I wanted to go
Totally.
back to it.
Mhm.
Um, so that's kind of where I'm at now. Well, there's a lot more that's happened since then, but I'm at a place where Sonia and I had talked for a long time about traveling. Ryan was going to graduate high school, and we were going to be free. I only have one child. She didn't have any children, couldn't have children. Um, and Ryan graduated high school after she got diagnosed with cancer. So we didn't have that chance. But she was infatuated with tiny houses and watching those tiny house
Mhm.
shows, and
Yeah.
thought it would be just awesome to either have a tiny house or, like an RV, and be able to just travel the country. And so that was something we kicked around. And because of my job, I'm able to um, probably very soon get into travel nursing. And even in hospice, they hire travel nurses all over the country. So I am moving forward now with, probably in the next, hopefully, 4 to 6 weeks, taking my first travel assignment. And I'm going, the first place I'm going to try to go. There are currently openings right now, and they're trying to get me to move a little faster. But I'm trying to square away everything here before
Yeah.
I do that. Is Denver. So I'll probably travel to Colorado first. I have a lot of friends still in Colorado from when I lived there. I have a place to stay that
Mhm.
is free of charge. So, and travel nurses, the money is very lucrative too, because if you have a situation where you either have your own RV, so your overhead's very low, or you have somewhere, family or friends that you stay with, then they give you a housing stipend every month, which is tax free, and you just get to pocket that. So it can be lucrative too.
Nice.
But the
Yeah.
bigger thing is, I'm going to get to do the traveling that we talked about doing, and possibly kind of again, this whole purpose thing for me is big, not just in the hospice nursing, but I think kind of in this community. I have to believe that I went through this more than one time, and there has to be some purpose to that. Does that make sense?
Yeah, it makes sense.
So I don't know what that looks like, um, but I do know that as I go to these different places, and I'll be like, so they're usually 13-week assignments, so you're somewhere for about 3 months, and then you can either re-up if they decide that there's still the opening there, or you can move on to somewhere else. So kind of what's in my head is to kind of travel from place to place and meet people that are widowed and that are kind of going through the same things, and just make these connections that are deeper for support and for relationships are big, as far as we all kind of have these losses that make us very guarded and very vulnerable, and make it harder, I think, for us to trust and to really let other people know when we need help, because we're so guarded about being hurt and being we all have abandonment issues. We were all abandoned,
Yep.
even though they didn't have a choice in it. It still feels the same. It feels like abandonment. So I think there's something to there's what you guys do um, with this group and with doing these things, and then everything else, the gatherings, the meetups, and stuff like that. Those are all things that at face value they may not look like much, but I think have a much deeper meaning and purpose than sometimes we even give them credit for. So I really appreciate you
Oh, they
guys.
totally do.
Yeah, they do.
They,
They do.
we still see a therapist, and I tell her about our group all the time.
Really.
And it's interesting because I'll bring up some of the not specifics, obviously, but I'll bring up some stuff
Right.
that's been talked about that she
Right.
would have never thought to see that angle of.
Right.
And she's very fascinated with our group, actually.
Yeah. Well, and I mean, from an outsider and for somebody that's in that field, yeah, I'm not surprised, because what
Yeah.
I mean, as a researcher, we're kind of this huge resource um, of different things that different ways of looking at things. We have people all across the country and all across the world, really. So you have people of different cultures. So it's kind of fascinating to see when somebody throws a post out that's like, "This is a problem I'm having," and you get all of these different takes on it based on
Yeah.
we've all kind of had these common experiences, but then we've all had different experiences too. So it makes
Mm-hmm.
it very interesting to see the takes and the advice and things like that people have. And, you know, to be able to have the perspective of somebody that's been through what you've been through, and have several different people who have dealt with it in different ways, that's it. That's to me, that's more valuable than just going to sit down with a therapist that just says, well, here's the textbook
Totally.
answer. Here's the textbook way that we would
Totally.
deal with this. Because
Totally.
the real world, and this is the same in nursing, the real world is not the same as what's in school or what's in a textbook.
Mm-mm.
When you learn from living life, and you learn from gaining, and you learn from losing, and we've all lost, and so we've all learned, and we're still learning. It doesn't stop. And so yeah, so people ask kind of what and I know I'm a little more unique in that I've lost twice. And there are a handful of us. I've talked to kind of the handful of folks that I've run into that have lost more than one person. And so people ask, like, how can you risk doing that again? How can how do you go on after? I can't imagine. But you couldn't imagine the first time either till it happened, you know. And all I can say is um, the person that I am is not the person I would have been had I not a known and been with these two women, these two wonderful women. Nor is it the same had I not lost them. And so I feel like if I don't learn from that, then what a tragedy, it really would be if I haven't learned anything and if I don't make some effort to make meaning and purpose out of that. So that's kind of where I'm at.
So true. It's so true. You know, we're not lucky, but we are a little lucky in the sense that the times that this happened to us has allowed us to be able to have groups like this.
Yep.
Because, one of the things that my therapist mentioned to me when I first started discussing about things that we were talking about in the group and ways that we were helping each other cope, she said, going through my training, she's like, there wasn't social media then, and people
Right.
felt so much more isolated. And the fact that we can create groups like this now, I don't want to make it sound like it's more than it is. It is a lot, but it's a little groundbreaking.
Well, okay. So, for example, it is true, and I'm a testament to the truth of this because Cassie died in 2005.
Yep,
This
and you
was
didn't have
not
this.
here. There was
Mm-hmm.
nothing like this. Um,
Yep.
it was okay. So you had discussion boards. Nothing like this. So the fact that this technology is here now and that we are able to make these connections. Can you imagine? So in 2005, just think back, what would it have taken for you and I to have some kind of a face to face video chat? It would have been
I know.
almost
It would
impossible,
have.
if not impossible,
Yeah.
without going to
Yep.
some other spot where they had some massive, screen and professional things did that then. But now
Yep.
you flip your phone, you hit a button, and you can literally be face to face with someone, talking to them
Yep.
and seeing their expressions because you and I both know it's not the same talking to someone on the phone. It's definitely not the same reading someone's texts. When you and I are
Mm-mm.
sitting face to face, your body language, my body language, your facial expression, all of these things that we don't get in these other types of communication.
Totally.
So this is so great. It's awesome. It's valuable. So, and one of the things I'm thinking about doing is, I took up motorcycle riding after,
Mm-hmm.
after Sonia died. I bought a motorcycle. I've always wanted one. But she was hesitant to, she was worried about me. So,
Mm-hmm.
but I did buy a bike. And so when I was shopping for a motorcycle, I, a little OCD. So, um, I kind of over analyze things and I try to get as much information as I can before I make a big purchase and things like that. So I was
Mm-hmm.
going through reading on bikes, and then I go on YouTube and I'm like, let me see if I can find some bike reviews. And so what I discovered was these people that do these things called moto vlogs. So they have a camera that is attached to their helmet and they'll take test rides of bikes. And then there's other people that they kind of do a blog while they're riding their motorcycle, talk about random things. But
While they're doing it?
no, well, they talk. So they'll take
No,
out.
I know. I know.
Yeah, I guess. So they'll have a GoPro that's attached to their helmet,
Mm-hmm.
and you'll get to see kind of first person view of what they're seeing. So you'll have people that are riding through the mountain, beautiful places that you know, when would you, unless you did that, when would you get to see that kind of stuff?
Yeah, exactly.
So I've kind of got this thing in my head of doing something like that, but that's exclusive for the widow community, you know, and just talking about experiences and kind of fielding questions. Um, so it's a thought, you know. I may give that a shot somewhere down the road. Um, but
Yeah,
there's
sounds very
there's
interesting.
so much. I mean, there's so much technology. It makes it so easy to just do something, you
Yeah,
know. And not
yeah,
everything is for everybody, you know. I mean,
yep,
some people will like it, and some
yep,
people won't care for it, and that's fine too,
yep,
you know.
yep.
Was, you know, somebody was talking on one of the strings, and they were. I'm always fascinated about these groups because somebody said they were an admin or whatever for a Clark Gable fan group. I'm like, okay, there's a
Clark Gable.
Clark Gable fan group,
Cool.
and there's a lot of people in it, and they're obsessed with Clark
Wow.
Gable. That's their
Wow.
thing, you know. So
Hmm.
kind of everybody has their thing, and so
Yeah.
I think there's something there. We'll figure it out, but I'm excited about kind of moving forward and moving into um, something new, you know, and something different. I think it's time for something different. I was her caregiver for 4 years, and everybody that's done that knows it takes a toll.
Hmm.
And but it's you wouldn't have it any other way. You know, everybody's kind of I think has that feeling.
Yeah.
So that's where I'm at.
Yep. Yep. Oh my God, I just want to give you like the biggest bear hug right now.
One day I'll be up there. We'll have a gathering or something. I get to hug you.
Yeah. Yeah. I'm looking forward to that.
Yeah,
I'm so looking forward to that.
yeah. Thank you for
Yeah.
rearranging your schedule. This was great.
Oh my God, please. It's fine. I don't mind doing it at all. I love talking to you guys.
Yeah,
I love getting to know you guys.
I think
It's
it's a
one of
good
the
thing.
biggest perks of this whole thing.
Yeah, it's a good thing. It's
It is terrific.
it's kind of cathartic. I think for everybody, you know, to do
Yeah.
it for you. I'm sure it is, and for us when we watch and participate. So sorry I didn't get to.
Yeah, it's a
Hi
distance.
everybody.
It's like a triangle. You
Yep.
know, we all
We
we
all
all work.
benefit.
Yeah, we all work together with you know what I mean.
Somebody is gonna make
It
fun
all
of you
works for each of
real
us in
bad
a
right
different
now.
way. What?
Someone's gonna make
What?
fun of that right now. Hold on, who's in here?
Okay, all
John
right.
Starnes
See, I would never do
here.
that. I would put
Okay,
my
yeah,
foot in my mouth.
it's all
No.
right.
Yeah. Mm. Thanks. Thanks for that.
It's cute.
I'm sure they're now there
Oh,
will be
it's
more of them.
the hounds have been unleashed. Yeah, but it's fun,
Yep. The
you know,
hell.
and it's a good thing that a place to have because I had dark humor already. I was already widowed and I was already a
Hmm.
hospice nurse, and you can't do any of those things without having kind of a dark sense of humor and being able to
Oh yeah.
laugh at yourself and at death and at sadness. You can't maintain your sanity. So this group
Yeah.
is fucking awesome for that. We all kind of just share this common sense of humor, and usually almost everyone kind of gets it. When you crack a joke that if you put on your regular page would have a lot of people appalled. So
Yeah.
yeah.
Yep.
So anyway, it's a great place, and I know I am, and I know everybody else is very grateful to have a place like this. So thank you guys
Yeah.
for
I
everything you
I
do.
I think I'm so grateful all the time for this group. It's crazy.
It's a great group.
It's
Yeah,
crazy.
it's a great
I
group.
almost get emotional sometimes when I talk to like people that I'm close to about it
Right.
because I
It's
wish I
like
could
family.
convey what it means to me, but it's hard to convey to people that don't understand.
Right. It's a
You know,
it is a family. It really is.
it's totally a family.
Um
It's
but
totally a family.
Yeah, there's really no other way to put it. It's just we have our
Yeah.
own little family, and you have to have had this experience to be able to be part of it, and that's just the way it is. It's almost like being blood related with someone. We kind of have
Yeah.
all the same blood,
Well, we do. We've all been through the
Yeah.
worst shit that we can imagine in our lives, and so there's, we can accept that from each other, and
Yeah.
because we can accept that from each other, we can be so candid.
Yep.
It's just incredible. It's just
Yeah.
incredible.
And it's great,
It's really incredible.
because look, I can't go next door and see my sister and have the same conversations. She
Yeah.
just doesn't get
Yep.
it.
Yep.
And she's my sister. I grew up with her.
I know.
I love her,
I know.
but she doesn't understand.
I know.
It's just the way it
I
is.
know. Yep. And you're glad, I'm glad they don't understand. I would
Oh.
never want them to understand.
Nope. I don't.
You
I
know?
don't want her to be part of
Yeah.
this family.
Yeah.
Because that means she would have to go through something equally as bad. And I don't want that for her. But at the same time, we're here. And so we got to be here. And I think we're making kind of more than the best of what, you know what I'm saying?
Yeah.
It's more than just making lemonade out of lemons. It's way more than that. It's deeper than that. So
way more than that. It's way more than that. Oh God, Les. Thank you so much.
Thank you. Thanks for giving me the opportunity. It was good. It's good to do this.
Of course.
I would encourage anyone that hasn't done it definitely to do it when they feel like it's time.
Yeah, when they're ready.
Yeah.
When they're ready.
But it is cathartic for sure.
It is. It really is.
Thank.
Okay. Well, you're off to a meetup, right?
Yeah, this will be the first
first
one I've ever been to. It's in Dallas. Yeah.
Nice. That's awesome.
So
that's
we'll
awesome.
See.
Have a
Yeah,
really,
it should be fun.
really good time.
I will. I'm sure we'll take pictures and stuff. So we'll post some stuff later.
You better take pictures. I want to see pictures.
Of course. All right.
Yes.
Thank you, everybody, for watching. Hope you guys enjoyed it.
Thank you guys so much. Big hug, Les. Big, giant hug.
Right back at you.
Have fun, okay?
All right. I'll talk to you later.
Okay. I'll talk to you later.
Bye.
Bye, Les.
Bye.
Bye, guys.